are suffering from one or the other kind of a mental illness. But if you look at the definition of health, it says health is a complete state of physical, mental, and social well being, not merely the absence of disease or infirmity. If you wanted to say that you are healthy, you should be good in three domains. One is a physical domain, second is a mental domain, third is a social domain. And you should be good in all aspects. But yes, I'm physically all right, but mentally not okay. But I have some issue, I don't know what it is. But socially, you have certain difficulties in terms of establishing relationship, maintaining it, and understanding your community and contributing to it. So this will contribute the one or the other kind of a problem. So therefore, without mental health, the definition of health doesn't complete. And what is mental health? Generally, people understand that the mental health is the absence of disease, sorry, absence of mental disorders or disease. But the World Health Organization, which explains mental health in 4 points. The World Health Organization, which explains mental health in 4 points. Number one is the way we cope up to the normal stresses of life. The stress is one which has been occupied every corner. I'm sorry. The stress is one which has been occupied every corner. So we have so many stresses, we have so many sources of stresses, we face all of them. And how do we handle those stresses matters a lot. Okay, matters a lot. That's what, how we cope up to the normal daily stresses is a part of your mental health. Second, realizing our abilities, strengths, and potentialities. In what aspects, in what area, in what domain, in what work, in what task I'm good, and where I need to improve myself. Okay, having an idea,
Sir,
having
your
a
voice
real.
is broken.
Uh, okay,
Sir,
any questions,
voice is broken, sir.
Nitin?
Your voice not clear, sir. Broken.
My voice is
I think internet
okay.
issue, sir.
What about now?
Okay, sir. Okay.
Okay, you're able to hear me?
Yes, sir.
Ah,
Yes, sir.
Okay,
Yes,
sir.
sir.
Yes,
Yes,
my
sir.
voice
audible, audible,
ಕೇಳಿಸ್ತಿದ್ಯಾ?
sir,
My voice
audible.
ಕೇಳಿಸ್ತಿದ್ಯಾ?
No problem. Audible,
Yes,
Yes,
sir.
sir.
Yes,
audible,
sir.
sir, audible.
Okay, thank you so much. So in between, like you face any glitches or any kind of a thing, you just raise your hands and ask me questions. No worry. Thank you. So realizing our abilities and leading a productive life is also part of your mental health. Leading a productive life is what? The kind of task, the kind of work that you do every day. So you should have a pleasure out of it. And end of the day, you should feel satisfaction. Yes, I did some good work today. I'm happy about my work. I'm happy about my performance. Okay. So when you have sense of this feeling, that is again part of your mental health. Next, to contribute to our own community, the community where you live, the community where you reside and work, and at least you should contribute something that you can contribute to your community. So WHO, if you're good in all these four aspects, then you can say yes, somewhat I'm mentally sound. Then what is mental illness is a big question. Okay, because you must understand the mental illness this way. So there are two types of the illness can be classified into two types. One is a mental illness, second one is a physical illness. But when it comes to the physical illness, when the illness comes to your body shows the symptom. Okay, suppose you take example, I have a fever, my body temperature increases, then I feel bitter, I can't eat, and I can't sleep, body ache, etc. So easily we can identify that yes, he is sick and he is having a fever. But when it comes to the mental illness or mental health, the symptoms will be in terms of behavioral changes. Physically, the person looks normal and you can't identify, you can't see any kind of illness in physical aspects. But when it comes to the behavior, there will be certain changes. Okay. But generally, we fail identifying a behavioral changes. We attribute it to something else, like probably some he's not okay and he's sad because something is not okay in his life, but he will be all right after some times. Okay. So this is a general notion which has been there among the people. But we need to understand the behavioral changes are very important. Very important. Any illness you take, there are two areas in life which disturbs very, deeply, the number one is a sleep and second one is a food. When you're not eating your food properly, when you're not sleeping properly, that means you need to understand something is not okay with me, either physically or mentally. Okay. But when it comes to the mental illness, look at the definition. It goes like that: a disorder affecting thinking, the way we think, the way we process our thinking, and then the mood. Okay. So the moods like affections, there are different. You take example, sad or being happy, or uh, feeling surprise, or hangry, or anxiety. These are certain feelings, or these are certain emotions. So these emotions will fluctuate to some pattern. To some pattern, these emotions will fluctuate. This is normal. But most of the time in a day, if you stay sad, most of the time in a day, if you look so happy, it is going to disturb your personal life. It is going to disturb your professional life. It will not let you to perform your daily task. So therefore, the mood is one. Perception, the way we understand the world. Orientation, whether I'm able to understand the time of the day, whether I'm able to understand or able to recognize the people around me, and the memory, whether I have any forgetfulness, the past events and recent events, and judgment because of my thoughts, because of my moods, I'm able to judge what is happening currently or not, behavior and daily function, and mental illness, which also includes alcohol and drug abuse. But still, in our community and our society, using a tobacco, using a alcohol, people consider it as an habit, not as an illness. But these two and other drug abuse also can turn to be an illness, can turn to be an illness. Therefore, this is what we need to understand. Next, let me come to the mental well-being. This is very interesting topic, actually. Mental well-being is very interesting topic. I hope now you understood what is the definition of mental health and what state of condition we can call it as a mental health. But when it comes to the mental well-being, I tell you one story because it varies from person to person. The things which I perceive it as a very good, the similarly other person will not. Yesterday, I met one patient and he had an anxiety issue. It was a full-blown anxiety. He had an anxiety issue. Then he came to me, he said, "Sir, I have decided to quit my job." He was working in a private sector. "I have decided to quit my job." Then I asked him like, "What is your package?" Then he said, "I'm earning nearly around 8 lakhs, sir. That's my package. And my wife is also going to the job and she earns nearly around 25,000 rupees or 30,000 rupees per month. And for household expenses and all, like we take, my wife's money, but my money, what I earn, it will go to the savings." Then I told him like 8 lakh is a huge money. 8 lakh is not a small amount. 8 lakh is very huge money. Then I asked him like, "What made you to quit the job?" Then he said, "Sir, really, I am finding it difficult to adjust with the job, adjust with the project, and especially people and my speed. And sometimes I'm not able to sleep. I'm not able to eat. Even if I sit for eating, the same kind of a meeting and meeting content, it is coming to my mind. I'm not able to sleep. This is what is difficult." Then like, "What do you want to do after quitting a job?" Then he said, "I just wanted to relax at home, sir. Let me take 2 months of break." Okay, after 2 months of break, what do you do? He said, "Sir, I'm very good in car driving. I will buy a car, one small second-hand car. I take it as my profession. So I'll go for trips. I'll go for trips means like he will drive a cab, Ola and Uber. He will subscribe to the Ola and Uber and he will do it. Okay. So then how I asked him the one more question, how it is going to help you? And he said, "Sir, like there won't be pressure. I follow the signals, I follow the rules, and the passenger who is sitting in a back seat, he will not ask me anything. Okay, so the system, it directs me where I should go. Very limited communication, no stress. Even I can less money, but I'll be okay. I'll be okay." See, if you look at here, according to him, the mental well-being is what? Just reducing the stress in a job, staying alone, limited communication, earning even less money, spending quality of time with the family, okay? Spending quality of time with the family and enjoying his job. enjoying his job. That is his mental well-being. I've seen some people, they earn really great amount and the family is really good. All family members, everyone is settled, but having a lot of health issues and not even ready to eat like what they wishes to eat. So that way, mental well-being is not a stagnant or static concept. It is a dynamic. It varies from person to person. The way I perceive certain things may not be similarly by other person. So therefore, we need to understand from a different perspective and especially from our perspective what is mental well-being. Therefore, I say the what content that I'm going to cover. So these content are taken from the research based and second psychological based and philosophical base. Now, let me tell you, what do you want in life? This is my question. I just expect some responses from the audience. What do you want in life? And don't mind about your answer. You just say your answer.
Peace.
Sir, peaceful life,
Madam?
sir.
Peaceful life. Okay, next.
Happiness.
Happiness. Great. Okay, next.
Comfort.
Love and care, sir. Love and care.
Dr. Gayatri, you're saying something, but I'm not able to hear it.
Peaceful, sir.
Peace of mind.
Peace of mind. Okay.
Comfort.
Okay. Okay. Now I asked one more question. People, okay, let me tell you. People who are living in Ukraine or Gaza, you just imagine yourself, you're living in a Gaza or you're living in a Ukraine because why? War zones. Now tell me your answers. Like, what do you want in life? Sir, there is a crosstalk. I request you, please mute
Safety.
yourself.
Experience,
Sir,
sir.
you're telling something.
Sir,
Suppose you're living in a Gaza or you're living in a Ukraine. What do you want that time?
Just want to get out of that area,
Peace,
sir.
peace.
Okay, you just wanted to get out of the
That
place.
area.
Okay, fine. You're working in a very good company and earning very good, but every day you have a night shift. What do you want?
In comparison with Gaza, sir.
Huh? Yeah. No. Simply just imagine you every day you have a night
We
shift.
want to change our
What do you want?
lifestyle.
You wanted.
Sir, we
You want
left
to
your
change
job,
your.
sir.
Okay. See,
The left job.
persevering. Okay. Now let us go for the next slide. Okay. How do you rate your well-being and happiness on the scale of 0 to 10? How much you rate?
8 to 10.
Okay, 8 to 10. Great. Next.
Yes, sir. It's 6 to 8.
6 to 8. Okay.
6 to 7.
6 to 7. Okay.
8, sir.
5 to 10. 5 to 10.
Sir,
5 to
8
5
to
to
9.
no
8 to
sir.
9, sir.
5 to 10. 5 to 10 is very long. You just minimize it. I just need a small class interval.
9 and
Okay.
8.
Let me make the question a little bit twist. Go back around 15 years back. Go back 15 years back. Now you rate your happiness. Now you are all like around 30 years old, 30 years and 35 years old. Now tell me how do you rate your happiness and well-being?
Up to 10, sir. Out of 4, sir.
See,
Okay.
3 only.
So 10, somebody said 10, madam. Okay, next. Now you're all 30, 35 years old. Rate your happiness and well-being.
10,
10,
sir. Out
okay.
of 10, sir.
10, very good. Oh, next. Next.
15 years back, it's 15 points, sir.
Sir, please
9,
repeat, sir.
sir.
9. Okay, next.
Sir, 8 to 9. 8 to 9, sir.
Okay, 8 to 9. Okay. Any other responses?
6 to 7.
9
to 10.
That's a 7 to
5 to
8.
10 applicable, sir.
I don't know why it has
10.
come down. When you are 30, 35, somebody rated around 10, and now you are saying around 6 or 7 or 8, between like 5 to 10. Like, what makes you to say like that? ಈ ತರ ಹೇಳಲಿಕ್ಕೆ ಕಾರಣ ಏನು? ಯಾಕೆ ಈ ತರದ್ದು ರೆಸ್ಪಾನ್ಸಸ್ ಬರ್ತಾ ಇದೆ?
Responsibility, sir.
ಅವಾಗ ಕೆಲಸ ಇರಲಿಲ್ಲ ಸರ್.
ಅವಾಗ
Sir,
ಕೆಲಸ ಇರಲಿಲ್ಲ.
commitments, work pressure. It's depend upon situation, sir.
Depend upon situation. So your well-being
Situation
also
and
varies.
age. Yeah.
Uh-huh. Okay, okay,
Age and body cooperation, sir. Age.
okay. So
When
you
I
mean to
was
say
13
like,
year, I don't
uh-huh.
have responsibilities and other pressures.
Okay,
There is one way life, sir.
okay, 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 okay. See, this is what, like if you go back 10, 15 years, you rate 10 out of 10.
Of work, sir.
Even if you go back around 15, 20 years, like
Sir, I
you will
think.
make it 10 of
Either.
10. Okay, let us go further. Now you wanted to assess your well-being. What is the level of your well-being?
At
Now
present, sir,
6
5
to
to 6,
7,
sir.
sir.
No, you wanted to assess now individually.
Sir, 5 to 6, sir.
No, out of this, sir, I will give you I will give you certain questions.
Yes.
You just apply on yourself.
Yeah.
ಆ ಪ್ರಶ್ನೆಗಳನ್ನ ಓದಿ ನಿಮಗೆ ನೀವೇ ಅಪ್ಲೈ ಮಾಡ್ಕೊಳ್ಳಿ. ಅದಾದ್ಮೇಲೆ ನಾನು ಕಟ್ ಆಫ್ ಸ್ಕೋರ್ ಕೊಡ್ತೇನೆ ನಿಮಗೆ.
Okay, sir. Okay, sir. Okay, sir.
Okay, yeah. Just go through these questions. Take around 3 minutes of time. Go through these questions. There are 15 questions. 15 ಪ್ರಶ್ನೆ ಇದೆ. ಎಲ್ಲ ಪ್ರಶ್ನೆಗಳನ್ನ ಓದಿ you mark your response and then submit. You will get a total score. Then I will give you cut off. So there are 14 questions, I feel. 14 questions. The questions are very easy. You can just okay, done.
Yes, sir, it has been done.
Oh, great. Okay, you just sum all your responses and the numbers that you have marked, and you will get a total score. I'll just give you the cutoff. The mid value is 35. So the higher the score indicates, the better the mental well-being. Okay, and you can administer these questions on your family members also. You feel that yes, let me see what happens. Even like you feel like any of your students are stressed, you just ask the student to mark these questions. Okay, at least you will get an idea what is happening. Okay, so the higher the score, better the mental well-being, and the mid value is 35. Okay, so let us move to the next slide.
Yes, sir.
Okay, fine. So now let me, oh, there are so many. Just 1 minute. I'll reshare my screen. Okay, you're able to see it, right?
Sure, sir.
Okay, fine. So if you look at the definition of mental well-being or well-being, the state of happiness with the low levels of distress and overall good physical and mental health outlook and good quality of life. But here I'm just going to talk about a little bit about the stress, because why everyone nowadays telling about stress. Because any event you take example, because now almost the students are approaching SSLC exams. SSLC exams hatra barta ide. I tell you one story. What happened? There was two students in a government school. They were studying. The one student was so brilliant and he was so studious. And on him, the school and the villagers had a very good expectation that he is going to score a very good marks. And the other student, he was just an average student, but he is very good in common sense. He's very good in common sense. That first student, he scored around 95%, 90% of marks in SSLC after the results. And the second student, he scored only 40% of marks. But the person who scored 40% of the marks, he was busy in distributing the sweets to the whole village. He was so happy. And the first student, like he scored 90% of the marks, he said, I'm very upset about my score. I don't want to go for further education. I was expecting nearly 95%, but I got only 90%. But on the way to him, like the second student who offered his sweets to him, then he said, I don't want to eat sweets. ನನಗೆ ಸ್ವೀಟ್ ತಿನ್ನೋದು ಬೇಡ, ನನಗೆ ತುಂಬಾ ಬೇಜಾರಾಗಿದೆ. ನಾನು 95% ಮಾರ್ಕ್ಸ್ ಬರಬೇಕಾಗಿತ್ತು, 90% ಬಂದಿದೆ. ಇಂಥ ಅವಮಾನ ಇಟ್ಕೊಂಡು ಯಾರು ಬದುಕ್ತಾರ? ಐ ಆಮ್ ಗೋಯಿಂಗ್ ಟು ಡೈ ಮೈ ಸೆಲ್ಫ್, ಐ ಆಮ್ ಗೋಯಿಂಗ್ ಟು ಕಿಲ್ ಮೈ ಸೆಲ್ಫ್ ಅಂತ ಹೇಳ್ದ. ಅದಕ್ಕೆ ಸೆಕೆಂಡ್ ಸ್ಟೂಡೆಂಟ್ ಹೇಳ್ದ, I said he was very good in common sense. He said, see, you scored 90% and you will get a seat in a very good college. And SSLC is not the end, and you can continue, you can score really good. ಈಗ ಹೋಗಿ ಸಾಯ್ತೀನಿ ಅಂತ ಹೇಳ್ತಾ ಇದ್ಯಾ, ಸತ್ಬಿಟ್ಟು ಮತ್ತೆ ಹುಟ್ಟಿ LKG ಇಂದ ಓದ್ಕೊಂಡ್ ಬರ್ತೀಯ 5% ಜಾಸ್ತಿ ತೆಗಿಲಿಕ್ಕೆ ಅಂತ ಕೇಳಿದ. ಓಕೆ, LKG ಇಂದ ಓದ್ಕೊಂಡ್ ಬರ್ತೀಯ 5% ಜಾಸ್ತಿ ತೆಗಿಲಿಕ್ಕೆ. See, this is how the situation is the same, but the response differs.
ನೋಡ್ರಿ, ಜಲವಿದ್ಯುತ್ ಶಕ್ತಿ ಉತ್ಪಾದಿಸ್ತಕ್ಕಂಥ ವಿದ್ಯುತ್ ಶಕ್ತಿ ಆಗಿದೆ.
The response is same, but the situation is same, the responses differs. Next, when you see the concept of well-being or happiness, okay, the life matters. There are three types of life generally we say. One is a pleasant life. Pleasant life, it focuses on enjoying a positive emotions. Positive emotions are happiness and bliss. Okay, these are positive emotions. So when you are able to enjoy these positive emotions most of the time, that means you're leading a pleasant life. The second is engaged or a good life. Engaged with a good life where use your strengths and talents in a work, love, friendship, parenting, and leisure to fully engage your life. That means you're going to find a meaning to your life. So when you are engaged, you're going to find a meaning to your life. So that means now you're all into the faculties, like you're working in universities or, are a different educational setup. Okay. So, like how, research, please, there are crosstalks. I request audience, please mute yourself. So, how potentially you can use your talents, you can use your, abilities in terms of teaching, in terms of maintaining your interpersonal relationship, in terms of parenting your children. So this is engaged life and good life. So this life will give you a sense of meaning and sense of happiness in your life. The third is a meaningful life. Meaningful life, use your strengths and talents to serve a bigger cause than yourself. So where you will be engaged more into the welfare of other people, and you will try to help them to the best possible extent. So this leads to the meaningful life. There are different concepts of life. Now, this is called as a wellness model. What do you want? Like, this model is called as a PERMA model. This model says if you wanted to be well, or if you wanted to lead a happy life, and these 5 domains are very important. The domain number 1 is positive emotions. there are two types of emotion. One is a negative emotions. Second one is a positive emotions. Positive emotions which contains happiness, bliss, etc. But negative emotions which contains sadness, anger, and anxiety, etc. Engagement like being deeply involved in your work. Okay, so how serious about your work, how serious about your achievement, how serious about fulfilling your goals. So this comes under the category of engagement. The third is a relationship, building a strong and meaningful relationship. Keep it in mind. These four called as the 4 C's. 4 C's. The 4 C's are very much important in maintaining any kind of a relationship. Number one, first C is called as compromise. Second C is called as contribution. Third C is called as communication. First is a compromise. Second is a contribution. Third is a communication. And fourth one is a cooperation. Okay. So communication, contribution, and compromise and cooperation. So these 4 C's are very much important in maintaining a relationship, very good relationship. Okay. So relationship is a reciprocal. You can't say that only I'm the only person is responsible for maintaining a relationship. But when you are into the relationship, the other person also is equally responsible in maintaining a relationship. And you always can't think that, yes, I should only take care of everything. The other person is not, it is not the other person's responsibility. You must understand. I just wanted to tell one more story with regard to this relationship. I was studying in Nimans. I was posted in a family therapy. So one couple came to the family therapy. They were nearly around 60 plus years. Both of them are 60 plus years. Husband had epilepsy disorder, epilepsy illness for about 13 years. 13 ವರ್ಷದಿಂದ ಗಂಡನ್ಗೆ ಮೂರ್ಛೆ ರೋಗ ಇತ್ತು. ಈ 60 ವರ್ಷ ಆಗಿದೆ ಇಬ್ರಿಗೂ, ಗಂಡ ಹೆಂಡತಿ ಇಬ್ರಿಗೂ ಕೂಡ 60 ವರ್ಷ ಆಗಿದೆ. ಈ 60 ವರ್ಷ ಆಗಿರೋನ್ನ ಫ್ಯಾಮಿಲಿ ಥೆರಪಿ ಕಳಿಸ್ಕೊಟ್ರು. ಯಾಕೆ ಅಂತ ಇವರಿಬ್ರು ತುಂಬಾ ಜಗಳ ಆಡ್ತಾರೆ, ಇವರಿಗೆ ಥೆರಪಿ ಬೇಕು ಅಂತ. ಅವರಿಬ್ರು ತುಂಬಾ ಜಗಳ ಆಡ್ತಾರೆ, ಥೆರಪಿ ಬೇಕು ಅಂತ ಹೇಳಿ ಇಲ್ಲಿ ಬಂದಾಗ ನಾವು ಅವ್ರನ್ನ ಮಾತಾಡಿಸ್ಕೊಂತ ಕುತ್ಕೊಂಡ್ವಿ. ಆ ಹೆಣ್ಮಗಳು 60 ವರ್ಷ ಆಗಿದೆ, ಅವ್ರು ನಮ್ಮನ್ನು ನೋಡ್ಬಿಟ್ಟು ಮುಖದ ಮೇಲೆ ಒಂಥರ ವಿಲಕ್ಷಣವಾದ ನಗು ಹೇಳಿದ್ರು, ಸರ್ ನಿಮಗೆ ಮದ್ವೆ ಆಗಿದೆಯೋ ಎಲ್ಲೋ ಗೊತ್ತಿಲ್ಲ ನಮ್ಗೆ, ನಿಮಗೆ ಮದ್ವೆ ಏನೋ ಮ್ಯಾರಿಟಲ್ ಲೈಫ್ ಅಂದ್ರೆ ಏನೋ ಗೊತ್ತಿಲ್ಲ ನಮ್ಗೆ, ನೀವೇನ್ ನಮ್ ಸಮಸ್ಯೆ ಬಗೆಹರಿಸ್ತೀರಾ ಅಂತಂದ ಹೇಳಿ ಕೇಳಿದ್ರು. ಅಮ್ಮ ಕೊನೆಗೆ ಇಲ್ಲ, ನಾವ್ ಈ ತರ ಟ್ರೈನ್ಡ್, ವಿ ಆರ್ ಅಂಡರ್ ದ ಸೂಪರ್ವಿಷನ್ ವಿ ಡೂ ಇಟ್, ನಾವ್ ಇದಕ್ಕೆ ಸಂಬಂಧಪಟ್ಟಂಗೆಲ್ಲ ನಮಗೆ ಟ್ರೈನ್ ಆಗಿರುತ್ತೆ ಅಂತಂದ ಹೇಳಿ ವಿ ಟೋಲ್ಡ್ ದೆಮ್, ಅವ್ರಿಗೆ ಹೇಳಿದ್ವಿ. ಕೊನೆಗೆ ಏನ್ ಪ್ರಾಬ್ಲಮ್ ಅಂತಂದ ಹೇಳಿದ್ರೆ, ಸರ್ ವಿಪರೀತ ಜಗಳ ಸರ್, ನನ್ ಗಂಡ ಸಿಕ್ಕಾಬಟ್ಟೆ ಕೋಪ ಮಾಡ್ಕೊಳ್ತಾನೆ. ಕೋಪ ಯಾವ ಲೆವೆಲ್ಗೆ ಇರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ ನಾನು ಏನು ಉತ್ತರ ಕೊಡಕ್ಕೆ ಆಗೋದಿಲ್ಲ, ತಿರುಗಿ ಅಷ್ಟು ಕೋಪ ಇರುತ್ತೆ.
ಸುಮಾರು 26 ದಶಲಕ್ಷ.
ಅದಕ್ಕೆ ನೀವೇನ್ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಅಂತ ಹೇಳಿದಾಗ, ನಾನ್ ಮಾತಾಡೋದೇ ಬಿಟ್ಬಿಟ್ಟಿದ್ದೀನಿ ಸರ್ ನನ್ನ ಗಂಡನ ಜೊತೆಗೆ. ಎಷ್ಟು ವರ್ಷ ಆಯ್ತು? ಸುಮಾರು ಒಂದು 5 ವರ್ಷ ಆಯ್ತು ಮಾತೇ ಆಡೋದಿಲ್ಲ. ಅವ್ರ ಪಾಡಿಗೆ ಅವ್ರು ಇರ್ತಾರೆ, ನನ್ನ ಪಾಡಿಗೆ ನಾನು ಇರ್ತೀನಿ. ಆದ್ರೂ ಕೂಡ ಗಂಡ ಬರೋದು, ಏನಾರು ಒಂದ್ ಸಣ್ಣ ಪುಟ್ಟ ವಿಚಾರಕ್ಕೆ ವಿಪರೀತವಾಗಿ ಬೈಯೋದು, ಹೋಗೋದು, ಹೆಂಡತಿ ಸುಮ್ನಿರೋದು. ಅವ್ರ ಪರಿಸ್ಥಿತಿ ಯಾವ ಲೆಕ್ಕಕ್ಕಿತ್ತು ಅಂತಂದ ಹೇಳಿದ್ರೆ, ದೇ ಯೂಸ್ ಟು ಕಮ್ ಟುಗೆದರ್ ಟು ದ ಹಾಸ್ಪಿಟಲ್. ಇಬ್ರು ಜೊತೆಗೆ ಬರ್ತಾ ಇದ್ರು. ಸೊ ದೆರ್ ವಾಸ್ ನಿಯರ್ಲಿ 10 feet ಗ್ಯಾಪ್. 10 ಅಡಿ ಜಾಗ ಇರ್ತಾ ಇತ್ತು. ಹೆಂಡತಿ ಮುಂದೆ ನಡ್ಕೊಂಡು ಹೋದ್ರೆ 10 ಅಡಿಯಿಂದ ಗಂಡ ನಡ್ಕೊಂಡ್ ಬರ್ತಾ ಇದ್ದ. ಸೊ ದೆನ್ ಆಯ್ತು, ವಿ ಟುಕ್ ಅ ಸೆಷನ್. ಅವ್ರಿಗೆ ಕೇಳಿದ್ವಿ ಏನಾಯ್ತು, ಏನು ಎತ್ತ ಅಂತಂದ ಹೇಳಿ. ಅವಾಗ ಹೇಳಿದ್ರು, ಇದೆಲ್ಲ ಆಯ್ತು ಸರ್, ಹಿಂಗೆಲ್ಲ ಆಯ್ತು, ನನ್ ಗಂಡ ಹಿಂಗೆ ಆತರ. ದೆನ್ ವಿ ಗೇವ್ ದೆಮ್ ಎ ಲಾಟ್ ಆಫ್ ಸ್ಟ್ರಾಟಜೀಸ್. ಜಗಳ ಆಡ್ಲಿಲ್ದಂಗೆ ಇರ್ಲಿಕ್ಕೆ ಏನೇನೆಲ್ಲ ತಂತ್ರಗಳನ್ನ ಬೇಕೋ ಅದೆಲ್ಲದನ್ನು ಕೊಟ್ವಿ. ದೆನ್ ವಿ ಟೋಲ್ಡ್ ದೆಮ್ 1 week ಆದ್ಮೇಲೆ ಬನ್ನಿ ಅಂತೇಳಿ. 1 week ಆದ್ಮೇಲೆ ಬಂದ್ರು. 1 week ಆದ್ಮೇಲೆ ಬಂದ್ರೆ ಏನಾದ್ರು ಉತ್ತಮ ಆಯ್ತಾ? ಏನು ಉತ್ತಮ ಇಲ್ಲ ಸರ್, ಸೇಮ್ ಹಂಗೆ ಜಗಳ ಮತ್ತೆ ಕಂಟಿನ್ಯೂ ಆಗ್ತದೆ. ಮತ್ತೆ ಹೇಳಿದ್ವಿ ಜಗಳ ಆಡ್ಬೇಡಿ ಅಂತಂದ ಹೇಳಿ. ವಿ ಗೇವ್ ಎ ಡಿಫ್ರೆಂಟ್ ಸ್ಟ್ರಾಟಜೀಸ್, ವಿ ಸೆಂಡ್ ದೆಮ್ ಬ್ಯಾಕ್. ದೇ ಟುಕ್ 1 week ಅಗೇನ್. ಮತ್ತೆ 1 ವಾರ ಆದ್ಮೇಲೆ ಬಂದ್ರು, ಇವಾಗ ಜಗಳ ಆಡ್ತಾ ಇದ್ದೀರಾ, ಸಿಕ್ಕಾಬಟ್ಟೆ ಜಗಳ ಆಗೋಗ್ಬಿಟ್ಟಿದೆ ಸರ್, ನಿಲ್ತಾನೆ ಇಲ್ಲ. ಅದೆಲ್ಲ ಅರ್ಥ ಮಾಡ್ಕೊಂಡಾದ್ಮೇಲೆ ದೆನ್ ವಿ ಸೆಡ್, ನಾವು ಹೇಳೋ ತನಕ ಜಗಳ ಆಡೋದು ನಿಲ್ಸಂಗಿಲ್ಲ, ನೀವು ಜಗಳ ಆಡ್ತಾನೆ ಇರ್ಬೇಕು. ಜಗಳ ಆಡ್ಲಿಕ್ಕೆ ವಿ ಗಿವ್ ದೆಮ್ ಎ ಪ್ರೋಟೋಕಾಲ್. ಒಂದು ಪ್ರೋಟೋಕಾಲ್ ಕೊಟ್ವಿ. ಏನು? ವಾರದಲ್ಲಿ 2 ದಿನ ಜಗಳ ಆಡ್ಬೇಕು. ಬುಧವಾರ ಸಂಜೆ 5 ರಿಂದ 6 ಗಂಟೆ ಜಗಳ, ಶನಿವಾರ ಸಂಜೆ 5 ರಿಂದ 6 ಗಂಟೆ ಜಗಳ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತಂದ ಹೇಳಿದ್ರೆ, ಗಂಡ ಏನೇನ್ ಮಾಡೋದು ನಿಮಗೆ ಇಷ್ಟ ಇಲ್ವೋ, ಹೆಂಡತಿ ಅದನ್ನೆಲ್ಲ ಪಟ್ಟಿ ಮಾಡಿ. ಹೆಂಡತಿ ಏನೇನ್ ಮಾಡೋದು ಇಷ್ಟ ಇಲ್ಲೋ, ಗಂಡ ನೀವು ಅದನ್ನೆಲ್ಲ ಪಟ್ಟಿ ಮಾಡಿ. ಆ ಪಟ್ಟಿನ ಇಟ್ಕೊಂಡ್ಬಿಟ್ಟು ಬುಧವಾರ ಸಂಜೆ 5 ರಿಂದ 6 ಗಂಟೆ ನೀವಿಬ್ರು ಜಗಳ ಆಡ್ಬೇಕು. ನೀನ್ ಇದನ್ ಮಾಡಿದ್ ಇಷ್ಟ ಇಲ್ಲ, ನೀನ್ ಇದನ್ ಮಾಡಿದ್ ಇಷ್ಟ ಇಲ್ಲ, ನೀನ್ ಹಂಗಂದೆ, ನಾನು ಹಿಂಗಂದೆ ಅಂತೇಳಿ ಜಗಳ ಆಡ್ಬೇಕು. It took 1 week. ಯಾವಾಗ ಬುಧವಾರ ಸಂಜೆ ಬಂತು ಜಗಳ ಆಡಿಲ್ಲ. ಬಿಕಾಸ್ ದೇ ಅಂಡರ್ಸ್ಟುಡ್ ದ ಲೀಸ್ಟ್ ದಟ್ ದೇ ಮೇಡ್ ಇಟ್ ಲುಕ್ ವಾಸ್ ಸೋ ಸಿಲಿ. ಈ ವಿಚಾರಕ್ಕೆ ಜಗಳ ಆಡೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. Okay. The second week, Saturday ಬಂದು Saturdayನೂ ಜಗಳ ಆಡಿಲ್ಲ. Next week they came to us, we asked, did you fight? They said no, we didn't fight. ಯಾಕೆ ಅಂತಂದು ಹೇಳಿದ್ರೆ ಸರ್ ನಮಗೆ ಈ ಲಕ್ಷಣ ಈ ಪಟ್ಟಿಯಲ್ಲಿ ಏನ್ ಮಾಡಿದ್ವಿ, ದೀಸ್ ಕಾಸಸ್ ಅಂಡ್ ದೀಸ್ ರೀಸನ್ಸ್ ವಿ ಫೆಲ್ಟ್ ಸೋ ಸಿಲ್ಲಿ, ಇದು ತುಂಬಾ ಸಿಲ್ಲಿ ಅಂತ ಅನಿಸ್ಬಿಡ್ತು ನಮಗೆ ಆಗ್ಲಿಲ್ಲ ಅಂತ. ಅಲ್ಲಿ ಆಕ್ಚುಲಿ ರೀಸನ್ಸ್ ಆರ್ ನಾಟ್ ಸಿಲ್ಲಿ. ವಿ ನೀಡ್ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಅಬೌಟ್ ದ ಎಮೋಷನ್ಸ್. ಆಂಗರ್ ಈಸ್ ಅ ಮೋಸ್ಟ್ ಪವರ್ಫುಲ್ ಎಮೋಷನ್. ಕೋಪ ಅನ್ನೋದು ತುಂಬಾ ಪವರ್ಫುಲ್ ಎಮೋಷನ್ಸ್. ಯು ಮಸ್ಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಹೌ ಟು ಚಾನಲೈಸ್ ಇಟ್. ಅದನ್ನ ಹೆಂಗೆ ಅರಿಬಿಡ್ಬೇಕು, ಹೆಂಗೆ ಅದನ್ನ ತೋರಿಸ್ಬೇಕು ಅನ್ನೋದನ್ನ ಒಂದು ಕಲೆ. ಸೊ ಕೋಪದಲ್ಲಿ ಇರುವಂತ ಮನಸ್ಸು, ದುಃಖದಲ್ಲಿ ಇರುವಂತ ಮನಸ್ಸು ಶಾಂತ ಆಗ್ಬೇಕು ಅಂದ್ರೆ ಅದ್ರ ಪಾಡಿಗೆ ಅದನ್ನ ಸ್ವಲ್ಪ ಸುಮ್ಮನೆ ಬಿಟ್ಬಿಡ್ಬೇಕು. ಓಕೆ, ಯು ಸಿ ಮೋಸ್ಟ್ ಆಫ್ ದ ಥಿಂಗ್ಸ್, ನಾವು ಕೋಪ ಜಾಸ್ತಿ ಮಾಡ್ಕೊಂತ ಇತ್ತು ಅಂದ್ರೆ ವಿ ಲೇಬಲ್ ಹಿಮ್, ಅವನು ಕೋಪಿಷ್ಟ ಅಂತ ಹೇಳಿ ಹೇಳ್ತಾ ಇರ್ತೀವಿ. ಓಕೆ, ಆ ಕೋಪಿಷ್ಟ ಅನ್ನೋ ಒಂದೇ ಒಂದು ಪದ ಎಂಟೈರ್ ಪರ್ಸನಾಲಿಟಿನ ರೆಪ್ರೆಸೆಂಟ್ ಮಾಡ್ಬಿಡುತ್ತೆ. ಅರ್ಥ ಆಗ್ತಿದಾರ? ಇನ್ನು ಒಂದು ತುಂಬಾ ದುಃಖದಲ್ಲಿ ಇರ್ತಾರೆ, ಅಳುಮುಂಜಿ ಅಂತ ಹೇಳ್ತೀವಿ. ಅಳುಮುಂಜಿ ಅನ್ನೋದು ಒಂದೇ ಪದ ಎಂಟೈರ್ ಪರ್ಸನಾಲಿಟಿನ ರೆಪ್ರೆಸೆಂಟ್ ಮಾಡುತ್ತೆ. ಸೊ ವೆನ್ ಇಟ್ ಕಮ್ಸ್ ಟು ದ ರಿಲೇಶನ್ಶಿಪ್, ಎಮೋಷನ್ಸ್ ಮ್ಯಾಟರ್ಸ್ ಅ ಲಾಟ್. ನಿಮ್ಮ ಮನೆಯಲ್ಲಾಗಿರ್ಬೋದು, ಅಟ್ ಯುವರ್ ಫ್ಯಾಮಿಲಿ, ವಿತ್ ಯುವರ್ ಚಿಲ್ಡ್ರನ್, ವಿತ್ ಯುವರ್ ಹಸ್ಬೆಂಡ್ ಆರ್ ವೈಫ್, ವಿತ್ ಯುವರ್ ನೈಬರ್ಸ್, ವಿತ್ ಯುವರ್ ರಿಲೇಟಿವ್ಸ್. Okay, when you're talking, you also must take care of your emotions. Okay, emotions play a major role in relationship. ತುಂಬಾ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿರೋ ರೋಲ್ ನ ಪ್ಲೇ ಮಾಡುತ್ತೆ ಎಮೋಷನ್ಸ್. ಓಕೆ, ಬಟ್ ಇಫ್ ಯು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಹೌ ಟು ಚಾನಲೈಸ್ ಯುವರ್ ಎಮೋಷನ್ಸ್ ಅಂಡ್ ಯುವರ್ ರಿಲೇಶನ್ಶಿಪ್ ವಿಲ್ ಬಿ ವೆರಿ ನೈಸ್. ಸೊ ದೇರ್ ಫೋರ್ ರಿಲೇಶನ್ಶಿಪ್ ಈಸ್ ಒನ್ ಇಂಟಿಗ್ರಲ್ ಪಾರ್ಟ್ ಆಫ್ ವೆಲ್-ಬೀಯಿಂಗ್. ನೆಕ್ಸ್ಟ್, ಮೀನಿಂಗ್. ಪರ್ಸ್ಯೂಯಿಂಗ್ ಎ ಸೆನ್ಸ್ ಆಫ್, just one second, pursuing a sense of purpose and meaning in life. ನಮ್ಮ ಜೀವನದಲ್ಲಿ ಒಂದು ಅರ್ಥ, accomplishment, what goal that you wanted to achieve. So this PAMA model talks. But if you look at the well-being from the Indian perspective, our script says that sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pashyantu ma kaschid dukkha bhag bhavet ante. May all be happy. So this is what we used to chant like every morning. May all be happy, may all be free from the disease, may all perceive good and may not suffer from the sorrow. It is there, it is a part of our culture. But how many of us we are following it? So that matters a lot. But barriers to the well-being. Okay, this is very important. As I say, the well-being varies from person to person. ಇದು ಒಬ್ರಿಂದ ಒಬ್ರಿಗೆ ಬೇರೆ ಆಗ್ತಾ ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಹಂಗೆ ನಾನು ಸಂತೋಷವಾಗಿರ್ಬೇಕು, ನಾನು ಚೆನ್ನಾಗಿರ್ಬೇಕು ಅಂತ ಬಂತು ಅಂತಂದಾಗ ನನಗೆ ಅಡೆತಡೆ ಅಂತಂದೇಳಿ ಏನಿದ್ದಾವೆ ಅಂತಂದೇಳಿ ನಾನು ನೋಡ್ಬೇಕಾಗುತ್ತೆ. ಮೊದಲನೇ ಅಡೆತಡೆ ಅಂತಂದ ಹೇಳಿದ್ರೆ, ಯು ಮಸ್ಟ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಇಂಟರ್ನಲ್ ಅಂಡ್ ಎಕ್ಸ್ಟರ್ನಲ್ ಕಾಸಸ್. ಇಂಟರ್ನಲ್ ಅಂಡ್ ಎಕ್ಸ್ಟರ್ನಲ್ ಕಾಸಸ್, ದಿಸ್ ಇಸ್ ವಾಟ್ ವಿ ಕಾಲ್ ಇಟ್ ಆಸ್ ಅ ಇಂಟರ್ನಲ್ ಲೋಕಸ್ ಆಫ್ ಕಂಟ್ರೋಲ್ ಅಂಡ್ ಎಕ್ಸ್ಟರ್ನಲ್ ಲೋಕಸ್ ಆಫ್ ಕಂಟ್ರೋಲ್ ಅಂತ ಹೇಳಿ ಕರಿತೀವಿ. ಅಂದ್ರೆ ನಾನು ಚೆನ್ನಾಗಿರ್ಲಿಕ್ಕೆ ನನ್ನಲ್ಲೇ ಇರುವಂತ ಕೆಲವೊಂದು ವಿಚಾರಗಳು ನನ್ನನ್ನು ಚೆನ್ನಾಗಿರ್ಲಿಕ್ಕೆ ಬಿಡ್ತಾ ಇಲ್ಲ. ಓಕೆ, ದಿಸ್ ಈಸ್ ಇಂಟರ್ನಲ್ ಲೋಕಸ್ ಆಫ್ ಕಂಟ್ರೋಲ್. ಎಕ್ಸಾಂಪಲ್ ಏನು ಅಂತಂದ ಹೇಳಿದ್ರೆ, ಐ ಆಲ್ವೇಸ್ ಡೂ ನೆಗೆಟಿವ್ ಥಿಂಕಿಂಗ್. Okay, I always do negative thinking. I don't trust other people very easily. Okay, I am very perfectionist. I want things to be like this only. I always, most of the time, show anger. Okay, these are internal things. But when it comes to the external things, anta bantu antandaga, the factors which are present in environment, ನಮ್ಮ ಪರಿಸರ, ನಮ್ಮ ವಾತಾವರಣದಲ್ಲಿ ಇರುವಂತದ್ದು, ನಮ್ಮ ಸುತ್ತಮುತ್ತಲಿನ ಜೀವನದಲ್ಲಿ ಇರುವಂತ ಕೆಲವೊಂದು ವಿಚಾರಗಳು ನನ್ನನ್ನ ಚೆನ್ನಾಗಿ ಇರ್ಲಿಕ್ಕೆ ಬಿಡ್ತಾ ಇಲ್ಲ. ಉದಾಹರಣೆಗೆ ಏನು ಅಂತ ಹೇಳಿದ್ರೆ, ಪಾವರ್ಟಿ, ಲ್ಯಾಕ್ ಆಫ್ ಸ್ಕೂಲಿಂಗ್. ನಮಗೆ ಒಳ್ಳೆ ಟೀಚರ್ಸ್ ಇಲ್ಲ ಆಗಿರ್ಬೋದು, ಸ್ಕೂಲ್ ಇಲ್ಲ ಆಗಿರ್ಬೋದು. ಓಕೆ, ಅಂಡ್ ಕಮ್ಯುನಿಟಿ ವೇರ್ ಐ ಲಿವ್ ವಿಚ್ ಇಸ್ ವೆರಿ ಸೆನ್ಸಿಟಿವ್, ದೇರ್ ಆರ್ ಲಾಟ್ ಆಫ್ ಕ್ಲಾಶಸ್, ತುಂಬಾ ಜಗಳ ಆಗ್ತಾ ಇರುತ್ತೆ. ಇನ್ನೊಂದು, ಸೊ ದೀಸ್ ಆರ್ ಎಕ್ಸ್ಟರ್ನಲ್ ಲೋಕಸ್ ಆಫ್ ಕಂಟ್ರೋಲ್. ಬಟ್ ಎಕ್ಸ್ಟರ್ನಲ್ ಲೋಕಸ್ ಆಫ್ ಕಂಟ್ರೋಲ್ ಅಥವಾ ಎಕ್ಸ್ಟರ್ನಲ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ವಿಚ್ ಆರ್ ನಾಟ್ ಇನ್ ಅವರ್ ಕಂಟ್ರೋಲ್, ಬಾಹ್ಯ ಪ್ರಪಂಚದಲ್ಲಿ ಇರುವಂತಹ ವಿಚಾರಗಳು ನಮ್ಮ ಕಂಟ್ರೋಲ್ ಅಲ್ಲಿ ಇಲ್ಲ. ಬಟ್ ಯು ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಕೇರ್ ಆಫ್ ಯುವರ್ ಇಂಟರ್ನಲ್ ಕಂಟ್ರೋಲ್ಸ್, ಅಂದ್ರೆ ಇಂಟರ್ನಲ್ ಫ್ಯಾಕ್ಟರ್ಸ್ ಗಳನ್ನ ನೀವು ಮಾಡಿಫೈ ಮಾಡ್ಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇದೆ. ಈ ತರದ್ದು ಯಾವುದು ಅಂತೇಳಿ ನೋಡ್ತಾ ಹೋಗೋಣ. ಮೊದಲನೇದೇನು ಅಂತ ಹೇಳಿದ್ರೆ, ಅನ್ಹೆಲ್ಪ್ಫುಲ್ ಥಿಂಕಿಂಗ್. ವಿ ಕಾಲ್ ಇಟ್ ಆಸ್ ಅನ್ಹೆಲ್ಪ್ಫುಲ್ ಥಿಂಕಿಂಗ್. ಸೊ ದ ಥಿಂಕಿಂಗ್ ಇಸ್, ಎವ್ರಿ ಒನ್ ಡಸ್ ಥಿಂಕಿಂಗ್, ಎಲ್ಲರೂ ಕೂಡ ಯೋಚನೆ ಮಾಡ್ತಾರೆ. ಬಟ್ ಹೇಗೆ ನಮ್ಮ ಯೋಚನೆ ನಮಗೆ ತೊಂದರೆ ಕೊಡುತ್ತೆ ಅಂತಂದೇಳಿ ಅರ್ಥ ಮಾಡ್ಕೊಂಡು, and there are very close connection between your thoughts, between your emotions, between your actions. A positive thoughts produces positive emotions, a positive emotions produces positive behavior. So therefore, having a positive thoughts, it also play a role in terms of producing a positive emotions and positive behavior, The positive behavior and positive emotions, which is tangible, which people can see it. ಅದನ್ನ ಜನಗಳು ನೋಡ್ಬೋದು, ಎಲ್ಲರಿಗೂ ಕೂಡ ಗೊತ್ತಾಗುತ್ತೆ. ಬಟ್ ಅನ್ಹೆಲ್ಪ್ಫುಲ್, ನಮಗೆ ಉಪಯೋಗಕ್ಕೆ ಬರ್ದಲೇ ಇರುವಂತ ಯೋಚನೆಗಳು ಯಾವ್ಯಾವ ತರ ನಾವು ಮಾಡ್ತೀವಿ ಅಂತ ಹೇಳಿದ್ರೆ, ಮೊದಲನೇದೇನು ಅಂತ ಹೇಳಿದ್ರೆ ಆಲ್ ಆರ್ ನಥಿಂಗ್ ಥಿಂಕಿಂಗ್ ಅಂತ ಕರಿತೀವಿ. ಆಲ್ ಆರ್ ನಥಿಂಗ್ ಥಿಂಕಿಂಗ್. Sometimes we call it as a black and white thinking ಅಂತಂದೆ. Okay, black and white thinking. Suppose you take example, I am not perfect, I have failed. I have failed. This is one thinking. Okay. You're all in academics. ನಿಮ್ಮ ಸ್ಟೂಡೆಂಟ್ಸ್ ಗಳ ಜೊತೆ ನೀವು ಮಾತಾಡುವಾಗ ನಿಮ್ ಗಮನಕ್ಕೆ ಬಂದಿರುತ್ತೆ, ಮೇಡಮ್ ನಾನು ಹಿಂಗ್ ಮಾಡ್ಬೇಕು ಅಂತ ಅನ್ಕೊಂಡಿದ್ದೆ, ನಾನು ಹಂಗ್ ಮಾಡ್ಬೇಕು ಅಂತ ಅನ್ಕೊಂಡಿದ್ದೆ, ಅದು ಹಿಂಗೆ ಬರ್ಬೇಕಾಗಿತ್ತು, ನನ್ನ ಕೈಲಿ ಆಗ್ಲಿಲ್ಲ, ನನಗೆ ತುಂಬಾ ಬೇಜಾರಾಗ್ತಾ ಇದೆ. ಸೊ they have done it, they have achieved 90% because their focus is on only 10%. Okay, this is called all or nothing thinking. Second is over generalization. Over generalization ಅತಿಯಾಗಿ ಸಾಮಾನ್ಯೀಕರಣಗೊಳಿಸ್ಬಿಡುವಂಥದ್ದು. Seeing a pattern based on a single event. ಯಾವುದೋ ಒಂದೇ ಒಂದು ಘಟನೆ ನಡೆದಿರುತ್ತೆ, ಆ ಘಟನೆ ಬೇಸ್ ಮೇಲೆ ಎಲ್ಲದನ್ನು ಕೂಡ ನಾವೇನ್ ಮಾಡ್ಬಿಡ್ತೀವಿ, ಇದು ಹಿಂಗೆ ಅಂತಂದು ಹೇಳಿ ಹೇಳ್ಬಿಡುವಂಥದ್ದು, ಇದು ಹಿಂಗೆ ಅಂತೇಳಿ ಹೇಳ್ಬಿಡುವಂಥದ್ದು. ಐ ಜಸ್ಟ್ ವಾಂಟೆಡ್ ಟು ಗಿವ್ ಒನ್ ಮೆಡಿಕಲ್ ಎಕ್ಸಾಂಪಲ್ ಹಿಯರ್. ಓಕೆ, ಏನು ಅಂತಂದು ಹೇಳಿದ್ರೆ, ಯು ಟೇಕ್ ಎಕ್ಸಾಂಪಲ್, ಎ ರೇಪ್ ಇನ್ಸಿಡೆಂಟ್ ಹ್ಯಾಪನ್ಡ್ ಆನ್ ಅ ಸ್ಮಾಲ್ ಚೈಲ್ಡ್, ಅರೌಂಡ್ 14-15 years child. ಆ ಇನ್ಸಿಡೆಂಟ್ ಇಂದ ಏನಾಗುತ್ತೆ ಅಂತಂದು ಹೇಳಿದ್ರೆ, ಶಿ ವಿಲ್ ಜನರಲೈಸ್ ದಟ್ ಆಲ್ ಮೆನ್ಸ್ ಆರ್ ಲೈಕ್ ದಟ್ ಓನ್ಲಿ. Example, this is very quite common in cases of the child abuse and domestic violence. Okay, ಒಂದೇ ಘಟನೆ ಇದೆಲ್ಲ ಒಂದೇ ತರ ಇರುತ್ತೆ, ಇದೆಲ್ಲ ಹಿಂಗೇನೆ ಅಂತಂದು ಹೇಳಿ ನಾವೇನ್ ಮಾಡೋದು, ಗುರ್ಸೋ ಅಂತದ್ದು. So this is called generalization. Next is a mental filter. Mental filter is what? Paying only attention on the negative things. This is called as a selective thinking. ಬರೀ 10 ವಿಚಾರಗಳಿರುತ್ತೆ ಅಂದ್ರೆ ಅದಕ್ಕೆ ಬರೀ 1 ಅಥವಾ 2ಕ್ಕೆ ಮಾತ್ರನೇ ಗಮನ ಕೊಡುವಂಥದ್ದು. Okay, this is what? The selective thinking. Selective thinking. Next is a disqualifying or positive. Discounting the good things that have happened, that you have done for some reasons, and another that doesn't count. Yes, there are very good, incidents. There are very good role that you have played, which has fetched a very good results and name and fame to you. ಕೆಲವೊಂದು ಘಟನೆಗಳಲ್ಲಿ ನೀವು ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾಡಿರ್ತೀರಾ, ತುಂಬಾ ಚೆನ್ನಾಗಿ ಪರ್ಫಾರ್ಮ್ ಮಾಡಿರ್ತೀರಾ, ಅದು ಒಳ್ಳೆಯ ಹೆಸರನ್ನ ತಂದ್ಕೊಟ್ಟಿರುತ್ತೆ, ಒಳ್ಳೆಯ ಶ್ರೇಯಸ್ಸನ್ನ ತಂದ್ಕೊಟ್ಟಿರುತ್ತೆ. ಬಟ್ ಯಾವುದೋ ಒಂದು ಘಟನೆ ನೀವು ಇವುಗಳನ್ನೆಲ್ಲ ಬಿಟ್ಟು ಆ ನೆಗೆಟಿವ್ ಆಗಿ ಏನಿರುತ್ತೋ ಅದನ್ನ ಮಾತ್ರನೇ ಫೋಕಸ್ ಮಾಡುವಂತ. ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಡಿಸ್ಕ್ವಾಲಿಫೈಯಿಂಗ್ ದ ಪಾಸಿಟಿವ್. ಅಂದ್ರೆ ನಿಮ್ಮ ಜೀವನದಲ್ಲೇ ನಡೆದಿರುವಂತಹ ಉತ್ತಮವಾಗಿರುವಂತಹ ಘಟನೆಗಳನ್ನ ತೆಗೆದು ಬೇರೆ ಕಡೆ ಹಾಕ್ಬಿಟ್ಟು ಬರೀ ನೆಗೆಟಿವ್ ಇವೆಂಟ್ಸ್ ಗಳನ್ನ ಮಾತ್ರನೇ ನೋಡುವಂತ. ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಡಿಸ್ಕ್ವಾಲಿಫೈಯಿಂಗ್ ಪಾಸಿಟಿವ್. Jumping to the conclusion, most people will do it is called as a mind reading in the narrative. Mind reading means what? Like, he thinks about me like that only. She thinks about me like that only. I did like this because they are talking about me only. ಬರೀ ಬೇರೆಯವರು ಹಂಗಂತಾರೆ, ಬೇರೆಯವರು ಹಿಂಗಂತಾರೆ, ಬೇರೆಯವರು ಆ ರೀತಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ದೀಸ್ ಆರ್ ಆಲ್ ನಾಟ್ ಎವಿಡೆನ್ಸ್ ಬೇಸ್. ಅಲ್ಲಿ ಏನೂ ಎವಿಡೆನ್ಸ್ ಇಲ್ಲ, ನಮ್ಮ ಆಲೋಚನೆಗಳೇ ಆ ರೀತಿ ಇದ್ದಾವೆ. ಓಕೆ, ದಿಸ್ ಇಸ್ ಜಂಪಿಂಗ್ ಟು ದ ಕನ್ಕ್ಲೂಷನ್. ಫಾರ್ಚ್ಯೂನ್ ಟೆಲಿಂಗ್. ಫಾರ್ಚ್ಯೂನ್ ಟೆಲಿಂಗ್ ಅಂತ ಹೇಳಿದ್ರೆ ನಾವೇ ಭವಿಷ್ಯ ಹೇಳ್ಬಿಡೋದು. ನಿಜವಾಗ್ಲೂ ಇವ್ರು ಹಿಂಗೆ ಮಾಡ್ತಾನೆ, ನಿಜವಾಗ್ಲೂ ಇವ್ರು ಹಿಂಗೆ ಮಾಡ್ತಾರೆ, ನನ್ನ ಹೆಂಡತಿ ಹಿಂಗೆ ಮಾಡ್ತಾರೆ, ನನ್ ಗಂಡ ಇದನ್ನ 2 ದಿನ ಸರಿ ಇರ್ತಾನೆ, 3ನೇ ದಿನ ಹಿಂಗೆ ಮಾಡ್ತಾರೆ. ಓಕೆ, ದೀಸ್ ಆರ್ ಜಂಪಿಂಗ್ ಟು ದ ಕನ್ಕ್ಲೂಷನ್. ನೆಕ್ಸ್ಟ್, ಮ್ಯಾಗ್ನಿಫಿಕೇಶನ್, ಕ್ಯಾಟಾಸ್ಟ್ರಫೈಸಿಂಗ್ ಅಂತ ಹೇಳಿ ಕರೀತೀವಿ. ಕ್ಯಾಟಾಸ್ಟ್ರಫೈಸಿಂಗ್ ಅಂತ ಹೇಳಿದ್ರೆ ಮುಂದೆ ನಡೆಯುವಂತಹ ಘಟನೆಗಳನ್ನ ಭಯಭೀತ ರೂಪದಲ್ಲಿ ನಾವೇ ಕಲ್ಪನೆ ಮಾಡಿಕೊಳ್ಳುವಂಥದ್ದು, ಕಲ್ಪನೆ ಮಾಡಿಕೊಂಡು ಪ್ರಸ್ತುತ ಸನ್ನಿವೇಶವನ್ನ ಹಾಳು ಮಾಡ್ಕೊಳ್ಳುವಂಥದ್ದು. ಅರ್ಥ ಆಗ್ತಿದೆಯಲ್ಲ? ದಿಸ್ ಇಸ್ ವಾಟ್ ಕ್ಯಾಟಾಸ್ಟ್ರಫೈಸೇಷನ್. ಎಮೋಷನಲ್ ರೀಸನಿಂಗ್. ಎಮೋಷನಲ್ ರೀಸನಿಂಗ್ ಮೀನ್ಸ್ ಥಿಂಗ್ಸ್ ವಿ ಸಿ ಅಟ್ ಫ್ರಮ್ ದ ಎಮೋಷನ್ಸ್. ಭಾವನೆಗಳ ಆಧಾರದ ಮೇಲೆ ವಿಚಾರಗಳನ್ನ ಅವಲೋಕನೆ ಮಾಡುವಂಥದ್ದು. ಓಕೆ, ಯಾವಾಗಲೂ ವಿಚಾರಗಳನ್ನ ಅವಲೋಕನ ಮಾಡುವಾಗ ವಿ ಶುಡ್ ಯೂಸ್ ಎವಿಡೆನ್ಸ್, ವಿ ಶುಡ್ ಯೂಸ್ ರಾಷನಲ್, ವಿ ಶುಡ್ ಯೂಸ್ ದ ಸೈಂಟಿಫಿಕ್ ಮೆಥಡ್. But when you are not using your scientific method, when you are not using a rational, but analyzing a situation based on your emotions may lead to the may mislead you. Adu nimanna mislead ಮಾಡಬಹುದು. Therefore, emotional reasoning is not okay. And should and must statement. Should and must ಅಂತ ಹೇಳಿದ್ರೆ ನೀವು ಹಿಂಗೆ ಮಾಡಬೇಕು. ಕೆಲವೊಂದ್ಸಾರಿ ತಾಯಿ ಮಕ್ಕಳಿಗೆ ಹೇಳ್ತಾರೆ ಏನಂತಂದ್ರೆ 90 ಮಾರ್ಕ್ಸೇ ತೆಗಿಬೇಕು, ಬೆಳಗ್ಗೆ 4 ಗಂಟೆಗೆ ಎದ್ದೇಳ್ಬೇಕು, 5 ಗಂಟೆಗೆ ಎದ್ದು ಓದ್ಬೇಕು, ಇಷ್ಟೇ ಮಾಡಬೇಕು, ನಾನು ಹೇಳಿದ್ದನ್ನ ಮಾತ್ರನೇ ಕೇಳಬೇಕು, ಬೇರೆ ಯಾವುದನ್ನು ಕೇಳಬಾರ್ದು. ಸೊ ವೆನ್ ಯು ಮೇಕ್ ಅ ಮಸ್ಟ್ ಆರ್ ಶುಡ್ ಸ್ಟೇಟ್ಮೆಂಟ್, ಇಟ್ ಗಿವ್ಸ್ ಮೋರ್ ಸ್ಟ್ರೆಸ್. ತುಂಬಾ ಅಂದ್ರೆ ತುಂಬಾ ಸ್ಟ್ರೆಸ್ ಕೊಡುತ್ತೆ, ಅವ್ರಿಗೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅಂತಾನು ಗೊತ್ತಾಗುತ್ತಿಲ್ಲ. ನೆಕ್ಸ್ಟ್, ಲೇಬಲಿಂಗ್. ಲೇಬಲಿಂಗ್ ಇಸ್ ವಾಟ್? ಒಂದು ಘಟನೆ ನಮ್ಮ ಪ್ರಕಾರ ನಡೀಲಿಲ್ಲ ಅಂತ ಹೇಳಿದ್ರೆ ಥಿಂಕಿಂಗ್ ದಟ್ ಐ ಆಮ್ ಫೇಲ್ಯೂರ್, ನನ್ನ ಕೈಲಿ ಆಗಲ್ಲ ಬಿಡು, ನಾನು ಅಸಮರ್ಥ, ನಾನು ಉಪಯೋಗಕ್ಕೆ ಬರ್ದಲೇ ಇರೋ. ನೆಕ್ಸ್ಟ್, ಪರ್ಸನಲೈಸೇಷನ್. blaming yourself for other tasks. ಬೇರೆ ಯಾರೋ ಏನೋ ಮಾಡಿರ್ತಾರೆ ಅದಕ್ಕೆ ನನ್ನನ್ನು ನಾನು ಬ್ಲೇಮ್ ಮಾಡ್ಕೊಳ್ಳೋದು. These are certain unhelpful thinking. Okay, ನೀವು ಇದನ್ನ ಹೆಂಗ ಅರ್ಥ ಮಾಡ್ಕೋಬಹುದು ಅಂತಂದ ಹೇಳಿದ್ರೆ, when you ask certain open-ended question to the students ಆಗಿರ್ಬೋದು, to the family members ಆಗಿರ್ಬೋದು, to your children ಆಗಿರ್ಬೋದು, so the kind of answer that they give, through which you can understand what kind of a thinking they are doing. Okay, next, ಇದು ಬೇಡ. Social and environmental barriers. ನಮ್ಮ ಸೋಷಿಯಲ್ ವೆಲ್ಬೀಯಿಂಗ್ ಏನ್ ತೊಂದರೆ ಮಾಡುತ್ತೆ ಅಂತಂದ ಹೇಳಿದ್ರೆ, ಟಾಕ್ಸಿಕ್ ರಿಲೇಶನ್ಶಿಪ್, ವರ್ಕ್ ಪ್ಲೇಸ್ ಸ್ಟ್ರೆಸ್, ಲ್ಯಾಕ್ ಆಫ್ ಸಪೋರ್ಟ್ ಸಿಸ್ಟಮ್ ಅಂಡ್ ಫೈನಾನ್ಷಿಯಲ್ ಸ್ಟ್ರೆಸ್. ಐ ವಿಲ್ ಎಕ್ಸ್ಪ್ಲೈನ್ ದಿಸ್ ಲೇಟರ್. ನೆಕ್ಸ್ಟ್, ಅವರ್ ಪರ್ಸೆಪ್ಷನ್, ನಮ್ಮ ದೃಷ್ಟಿಕೋನಗಳು ನಮ್ಮ ವೆಲ್ಬೀಯಿಂಗ್ಗೆ ಹೇಗೆ ಇನ್ಫ್ಲೂಯೆನ್ಸ್ ಮಾಡುತ್ತೆ ಅಂತೇಳಿ ನೋಡ್ತಾ ಹೋಗೋಣ. ವಾಟ್ ಯು ಸಿ ಹಿಯರ್? ಏನ್ ನೋಡ್ತಾ ಇದ್ದೀರಾ ಇಲ್ಲಿ? ವಾಟ್ ಯು ಸಿ? ಸರ್ ನೀವು ಹೇಳಿ, ರಮೇಶ್ ಸರ್ ನೀವು ಹೇಳಿ, ಸರಿಯಾಗಿ ಕೇಳಿಸ್ಲಿಲ್ಲ, ಇನ್ನೊಂದು ಸರಿ ಹೇಳ್ತೀರಾ? Okay, birds in a line. Yes, sir. You are seeing a line.
Birds in a line, but in between there is no one bird is not there in the line.
One bird is sitting differently.
Yes, sir.
Okay, one bird is sitting differently. Okay, what does it mean? What do you see?
What is gap?
It is not coordinating with others.
Okay, that means like you're not coordinating. The bird is seeing in a different direction.
Yeah, that is
Sir, ಯೋಚನೆ ಮಾಡ್ತಕ್ಕಂಥ ಕ್ರಮ ಚೇಂಜ್ ಇದೆ ಸರ್.
ಡಿಫರೆಂಟ್ ಒಪಿನಿಯನ್ಸ್, ಯೋಚನೆ ಮಾಡೋದಕ್ಕಿಂತ ವಿಶೇಷವಾಗಿ ಅಥವಾ ಡಿಫರೆಂಟ್ ಆಗಿ ನೋಡ್ಬೇಕು ಅಂತ.
ಎಲ್ಲಾ ಸಿಚುವೇಶನ್ಸ್ ಗಳನ್ನು ಒಂದೇ ತರ ಯಾಕೆ ನೋಡ್ಬೇಕು, ಬೇರೆ ತರ ಯಾಕೆ ನೋಡಬಾರ್ದು? ಎಲ್ಲಾ ಘಟನೆಗಳನ್ನು ಒಂದೇ ತರ ಯಾಕೆ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು, ಬೇರೆ ತರ ಮಾಡಬಾರ್ದು?
ಎಸ್ ಸರ್, ಎಸ್ ಸರ್.
ಎಸ್, ದಿಸ್ ಇಸ್ ಅವರ್ ದೃಷ್ಟಿಕೋನ, ಅವರ್ ಪರ್ಸ್ಪೆಕ್ಟಿವ್ಸ್. ನಮ್ಮ ದೃಷ್ಟಿಕೋನಗಳು ಯಾವಾಗ್ಲೂ ಕೂಡ ಒಂದೇ ತರ, ಬೇರೆಯವರು ಅದೇ ತರನೇ ಮಾಡ್ತಾರೆ ನಾನು ಹಂಗೆ ಮಾಡ್ತೀನಿ ಅನ್ನೋದಕ್ಕಿಂತ, when you see it differently, you will get a unique ideas. Understood? You will get a unique ideas. Next, who is right here?
Both are right, sir. There is own way.
In their own ways, both are right.
Yeah, again, it's dependent on to see the things. It's
okay.
Based on the
so one is seeing 4, the other one is seeing 3.
Yeah.
Both are right.
Both are right. Sometimes we do argument that I am only right. Right? Sometimes we do argument like, no, I am only right. You're wrong. Why don't you why don't you try to understand the situation from other perspective? Probably you may get a new, probably you may understand another person. Yes, please. Someone is talking. Yes, please.
Perception differs.
Okay, fine. So therefore, I think Pushpalata madam,
We can
so please, there is a crosstalk. If you wanted to respond to it, please unmute yourself and respond. If no, please mute yourself. Okay. So yes, from our direction, from our perspectives, we are right. But saying that I am only the right is not good. Is not good. Sometimes it is unacceptable. So therefore, we need to see the things from other perspective also. Next. What are you seeing here?
different animals sitting in different positions.
Yes, different positions. Okay. The second image.
Second image.
Full and half empty.
Full and half.
Okay, how many of you are seeing half full?
Yes, sir. It's half full.
It's half full. How many of you are seeing half empty?
The glass will show the one's mindset.
Yes, true. Very good. It's a mindset. Okay. When you're seeing half full, it gives you pleasant or not? It looks like.
Yes, it's giving pleasant.
Yes. When you see half empty, how your feelings will be generally?
Quite negative.
Negative.
Yes, this is what. So the sir said, rightly pointed, it's a mindset. Okay, it's a mindset, because there are two. Generally, there are in a broad way, there are two types of mindset. One is a static, another is a growth mindset. Okay. So when you talk about the growth mindset, We always see this, and these
11 ಗೆ
obstacles are
submit
common.
ಆಗುತ್ತೆ ಇದು ಸೆಷನ್ 1 o'clock ಗೆ.
How many of you seeing a old lady?
Yes, old lady.
Yes, sir, it's visible.
How many of you seeing a old lady?
Yeah, I am seeing old lady. Yeah.
How many of you seeing a beautiful girl?
Both is looking, sir.
No, you tell me first when you see this, how
Old
many of
lady.
you have seen the beautiful girl?
Second time I saw.
Okay, so this is what I say. Well-being also like this. Okay, sometimes we see very beautiful things, sometimes we see very old things. Okay, one image, it gives you the two different versions of perceptions. One is a young lady, the another was an old lady. What do you see? How do you feel?
The old and
One
young.
is young lady and old person, sir. Hello?
Yes, please. Yes, ma'am, please.
One is a young lady and another one is old person, sir.
Okay, one is a old person, another one is a young lady. Is this image is the same or a different?
It's the same image.
Same image.
Same image, sir.
One is up and
Same.
down.
But those
It's up
the
and down.
images
Same
are
image, but
same.
direction changes.
Definitely, very good, very good. The same image, I just changed the direction. I just changed the direction. See what is happening. The one direction which is showing that very ugly lady, the second direction, I just changed the direction. So now the result is what? The beautiful lady that we are seeing. Understood? That we are seeing. What it takes only little amount of patience. It takes only the little amount of your common sense investment. Okay, let me see it from the different angle. Probably you may see different things and very beautiful things also. Next, this is what we call it as a frame of reference. What we perceive, what we understand, and there is a particular point is called as a frame of reference. That means the word looks differently depending upon a frame of reference. That's what I said. Half full, half empty. A person who sees it, some people may look it only, oh, this is half full. Some people may look it half empty. Why? This is because of the frame of reference. Let us see what is frame of reference. This is called lifestyle positions or life positions. Okay. How this frame of reference work? There are 4 boxes you can see. Either of the box like we will fit in. Suppose I see life as, I see other people as, I'm not okay, you're only okay. That means I'm putting myself down, I'm seeing other person up. Second is, I am also not okay, you're also not okay. Nanu sari illa, neenu sari illa. We are putting entire system down. Third, I am okay, you're not okay. Naan matra sari iddini, bereyavu yaru sari illa. This is, I'm putting myself up. The fourth position, I am also okay, you're also okay. I'm also okay, you're also okay. But when we talk about I am also okay, you're also okay, and you can maintain a very good relationship with other people. But only when you're putting yourself up, when you're putting other self down, this is not okay, this is not acceptable. Okay, this is called like you're more into it's a one step up position and one step down position. So therefore, this is a lifestyle positions or a life positions where you fit in. This is based on your experiences, based on your perception, based on your life circumstances. Next, sometimes what I require, ನನಗೆ ಏನು ಬೇಕು ಅದು ನನ್ನ ಬಿಹೇವಿಯರ್ ಅನ್ನ ಡಿಸೈಡ್ ಮಾಡುತ್ತೆ, ಅದು ನನ್ನ ಯೋಚನೆಗಳನ್ನ ಡಿಸೈಡ್ ಮಾಡುತ್ತೆ, ಅದು ನಾನು ಇರುವಂತ ರೀತಿಯನ್ನ ಡಿಸೈಡ್ ಮಾಡುತ್ತೆ. ಟೇಕ್ ಎಕ್ಸಾಂಪಲ್, ಜರ್ನಲಿಸ್ಟ್ ಒಂದು ಪ್ರಶ್ನೆ ಕೇಳ್ತಾನಂತೆ, ಏನಂತಂದ್ರೆ ವಾಟ್ ಈಸ್ ಯುವರ್ ಒಪಿನಿಯನ್ ಆನ್ ದ ಶಾರ್ಟೇಜ್ ಆಫ್ ದ ಫುಡ್ ಇನ್ ದ ರೆಸ್ಟ್ ಆಫ್ ದ ವರ್ಲ್ಡ್ ಅಂತ. ಜಗತ್ತಿನಲ್ಲಿ ಆಹಾರದ ಅಭಾವ ಇದೆಯಲ್ಲ, ಅದಕ್ಕೆ ನಿಮ್ಮ ಒಪಿನಿಯನ್ ಏನು ಅಂತಂದ ಹೇಳಿ ಒಬ್ಬ ಜರ್ನಲಿಸ್ಟ್ ಪ್ರಶ್ನೆ ಕೇಳ್ತಾನೆ. ಫಾರ್ ದಟ್ ಕ್ವಶನ್ 4 ದೇಶದ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಉತ್ತರ ಕೊಡ್ತಾರೆ ಅಂತ. ಏನಂತ ಅಂದ್ರೆ, ದ ಫಸ್ಟ್ ರೆಪ್ರೆಸೆಂಟೇಟಿವ್ ಫ್ರಮ್ ಆಫ್ರಿಕಾ, ಸೊಮಾಲಿಯಾದವನು ಇರ್ತಾನಂತೆ. ಅವನು ಕೇಳ್ತಾನಂತೆ, ವಾಟ್ ಈಸ್ ಯುವರ್ ಒಪಿನಿಯನ್ ಆನ್ ದ ಶಾರ್ಟೇಜ್ ಆಫ್ ದ ಫುಡ್ ಅಂತ ಹೇಳಿದ್ರೆ, ಫುಡ್ ಅಂದ್ರೆ ಏನು ಅದು ನನಗೆ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ ಅಂತ ಕೇಳ್ತಾನಂತೆ. ಫುಡ್ ಅಂದ್ರೆ ಏನು, ವಾಟ್ ಈಸ್ ದ ಫುಡ್, ಕೆನ್ ಯು ಪ್ಲೀಸ್ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಿ ದಟ್. Second person from Europe, he says anante, what is shortage? I don't know the meaning of a shortage. Please explain the meaning of a shortage anta keltane. The third person is from USA, America. He says ante, What is rest of the world? America means like a superpower country. It's a Dodanna anta karitivi. What is the rest of the world? I am everything anta heli. So this is the opinion of America. The fourth from the Arabian countries, he says, first you tell me what is the meaning of opinion. What is the meaning of opinion? So therefore, what is the shortage of what is your opinion of the shortage of the food in the rest of the world? See how people give a different response and answer to it. Similarly, what is our responses to the life questions? What is our responses to the different situation? What is What is our responses to the dynamics that happens in your office, that happens in your college, that happens in your department? Okay, because I see it my own way. Because what is not there, what is there, based on which I see it. Next, barriers because of barriers. One is the prejudice. Prejudice also causes the lower well-being because we judge everything based on the prejudice mindset. What other people talk about it, what other people tells, and what other people gave an opinion. We consider it and we will come to the judgment. Okay, so this judgment is not based on the evidence. This is based on the prejudice. An unexamined belief, the belief system that we have taken it from our ancestors, the belief system that we have taken it from our culture, practices, etc. Sometimes this belief also will disturb our well-being. So therefore, at least we should assess what belief system that we have, which is again contributing, which is again disturbing. Because I say, when it comes to the belief, so ನಮ್ಮ psychiatry research ಅಲ್ಲಿ ನೋಡ್ತು ಅಂತಂದು ಹೇಳಿದ್ರೆ 35 to 40% of the patients, when they have an illness, their first point of contact is not a doctor. Their first point of the contact is a faith healer. ಈ ದೇವಸ್ಥಾನ ಪೂಜೆ ಪುನಸ್ಕಾರ ತಂತ್ರ ಮಂತ್ರ ಆಚಾರ ವಿಚಾರ ಆಮೇಲೆ ಮಸ್ಜಿದ್ ಚರ್ಚ್ ಇವುಗಳಾಗಿರುತ್ತೆ. ಇದು ಯಾಕೆ ಬಂದಿದೆ ಅಂತ ಹೇಳಿದ್ರೆ ದಿಸ್ ಇಸ್ ಅವರ್ ಬಿಲೀಫ್ ಸಿಸ್ಟಮ್ ಬಿಕಾಸ್ ವಿ ಅಟ್ರಿಬ್ಯೂಟ್ ದ ಮೆಂಟಲ್ ಇಲ್ನೆಸ್ ಟು ದ ಇವಿಲ್ ಫೋರ್ಸಸ್. ದೆವ್ವ ಭೂತಗಳ ಚೇಷ್ಟೆಯೇ ಮಾನಸಿಕ ಕಾಯಿಲೆ ಅಂತ ಹೇಳಿ ಮಾಡಿರೋದು. ಇವಾಗ ಅದು ಕಡಿಮೆ ಆಗ್ತಾ ಇದೆ. ಯಾವಾಗ ಈ ತರದ ಬಿಲೀಫ್ ನಮಗೆ ಜಾಸ್ತಿ ಇರುತ್ತೆ, ಸೊ ದಟ್ ಟೈಮ್ ವಿ ರೆಫ್ಯೂಸ್ ಟು ಟೇಕ್ ಅ ಸೈಂಟಿಫಿಕ್ ಟ್ರೀಟ್ಮೆಂಟ್. Okay, we rely on the belief system, we rely on the conventional treatment. ಅದು ಸಮಸ್ಯೆಯನ್ನ ಇನ್ನೂ ಜಾಸ್ತಿ ಮಾಡುವಂತ ಸಂದರ್ಭ ಬರಬಹುದು. So therefore, you have a belief system, but evaluating your belief is always important. Next, we get a frame of reference from the way we raised. ನಮ್ಮನ್ನ ಬೆಳೆಸಿರೋ ರೀತಿ, ನಮ್ಮ ತಂದೆ ತಾಯಿ ನಮ್ಮನ್ನ ಯಾವ ರೀತಿ ನೋಡ್ಕೊಂಡಿದ್ದಾರೆ, ನಾವು ಯಾವ ವಾತಾವರಣದಲ್ಲಿ ಬೆಳೆದು ಬಂದಿದ್ದೀವಿ, ನಮ್ಮ ಎಜುಕೇಶನ್ ಆಗಿರ್ಬೋದು, ನಮ್ಮ ಆಚಾರ ವಿಚಾರ ಧರ್ಮ ಸಂಸ್ಕೃತಿ, ನಮ್ಮ ವಾಡಿಕೆಗಳು ಸಂಪ್ರದಾಯ, ಇವುಗಳು ಕೂಡ ಏನಾಗುತ್ತೆ ಅಂತಂದು ಹೇಳಿದ್ರೆ ನಮ್ಮ ನಮ್ಮ ಆಲೋಚನೆಗಳು ನಮ್ಮ ನಡವಳಿಕೆ ಮೇಲೆ ಪ್ರಭಾವ ಬೀರುತ್ತೆ. ಸೊ ವೈ ಐ ಸೇ ಬಿಕಾಸ್ even like you just say, there are a lot of psychological theory says that. So before the 5-6 years of age, the child was governed by the mother. Each and every activity of the child was governed by the mother. The mother, example, the mother will take a child to the temple and he says that fold your hand and pray to the God. At the same time, we also say that if you do a mistake, the God will take off your eyes. Okay, the God will take off your eyes. So from then onwards only we'll try to give a kind of a socialize. We just try to orient our child to the right things and right principles. That means we should not lie. Okay, we should be trustworthy. We should be loyal. This is what the frame of reference that we get it from, the way we raised. ಹಂಗಾಗಿ ತಂದೆ ತಾಯಿಗಳು ಕೇವಲ ಮಕ್ಕಳಿಗೆ ಬೇಕಾಗಿರೋದನ್ನು ಕೊಡಿಸೋದು ಅಷ್ಟೇ ಅಲ್ಲ, ಅವ್ರನ್ನ ಹೇಗೆ ಬೆಳೆಸ್ತಾರೆ ಅನ್ನೋದು ಕೂಡ it will decide, it will determine, and it will also help them in terms of the thinking and behavior. So this is very important. Next, we get from the frame of reference from our culture, geographic locations, the news that we consume, social medias, WhatsApp, Facebook, Twitter, and Snapchat, and Instagram. So what information that we consume more? Okay, what information that we use more? So what I'm interested towards, this will also decides our well-being. And ego and echo. If you think that I am the only supreme in this globe, but I am also part of the globe, there's a different two notions. Okay, ನಾನು ಒಬ್ಬನೇ ಶ್ರೇಷ್ಠ, ಜಗತ್ತಿನ ಎಲ್ಲಾ ಜೀವಿಗಳು ಶ್ರೇಷ್ಠ, ಅದರಲ್ಲಿ ನಾನು ಒಬ್ಬ, ಬೇರೆ ಬೇರೆ ತರದ ಆಲೋಚನೆ ಕೊಡುತ್ತೆ. Next, Overcoming the limiting, your frame of reference. Frame of reference ಅನ್ನ ಕಡಿಮೆ ಮಾಡ್ಕೊಳ್ಳೋದು ಹೇಗೆ ಅಂತಂದು ಹೇಳಿದ್ರೆ, recognize that your word is not only word. ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು, ನಾನಿರೋದು ಮಾತ್ರ, ನಾನಿರೋ ಪ್ರಪಂಚ ಒಂದೇ ಅಲ್ಲ. There are other people, there are other different perceptions that we need to understand. Next, understand that nobody knows everything. ಎಲ್ಲರಿಗೆ ಯಾವುದು ಕೂಡ ಗೊತ್ತಿಲ್ಲ. This is first. ತುಂಬಾ ಆರಾಮಾಗಿರ್ಬೇಕು ಅಂತಂದು ಹೇಳಿದ್ರೆ, the perfectionist ಅನ್ನೋದು ಏನಿದೆ ಅಲ್ಲ, that we have to come down. We have to reduce it. At least we have to reduce little percentage. Okay, so that it helps us a lot. Next, assumptions. The assumptions is a mother of all mess-ups. Yes, we need to assume. Okay, but ಒಂದು goal ಅನ್ನ set ಮಾಡುವಾಗ, ಒಂದು assumption ಅನ್ನ ಮಾಡುವಾಗ, we have to follow a technique called SMART. SMART. This is a SMART technique. S stands for specific, M stands for measurable, A stands for achievable, R stands for relevance, T stands for time bound. ನಿರ್ದಿಷ್ಟವಾಗಿ ಇರಬೇಕು, ಅಳತೆ ಮಾಡಬೇಕು, ಮಾಪನ ಮಾಡಬಹುದು. ಮೂರನೇದು, ಇದನ್ನ ನಾವು ಸಾಧಿಸಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇದೆ. ನಾಲ್ಕನೇದು, ಇದು ನಮಗೆ ಸೂಕ್ತವಾದದ್ದು, ನಮ್ಮ ವಿಚಾರಗಳಿಗೆ ಸಂಬಂಧಪಟ್ಟದ್ದೇ ಇದೆ. ಐದನೇದು, ನಿರ್ದಿಷ್ಟ ಸಮಯದಲ್ಲಿ ನಾವು ಇದನ್ನ ಪೂರ್ಣಗೊಳಿಸಬಹುದು. So these 5 SMART techniques are very important when you're setting a goals or when you're making any kind of assumptions. Next, I know exactly how you feel. Listen and empathetically understand. This is very important. Listen and empathetically understand. ಯಾವಾಗಲೂ ಕೂಡ ಮಾತಾಡೋದಕ್ಕಿಂತ ಕೇಳಿಸ್ಕೊಳ್ಳೋದು ಕೂಡ ಸಂಬಂಧ ವೃದ್ಧಿಸುತ್ತೆ. Therefore, yes, you have to talk at the same time. The listening also is very important skill. Next, enhancing happiness and well-being. Who you are is a question. Neev yaru? Who you are? Can I get some responses from the audience? Who you are?
Human being.
Okay, human being. ಅದು ತುಂಬಾ ಬ್ರಾಡ್ ಆಯ್ತು ಮೇಡಮ್. ಇನ್ನೊಂದು ಸ್ವಲ್ಪ you can make it a little bit of more concise,
Friend, I am Ramesh.
And I am mother of a kid.
Okay, you're mother of a kid. Okay.
I am myself.
You're myself. Okay. Next. There is something called as a mindfulness. We talk about mindfulness. Okay. Mindfulness is, in a conventional language, we call it as a meditation. Dhyana anteli kariti. But who you are, you must understand this. What kind of a person you are. When you start doing a meditation, the n number of thoughts will flow into your mind. Okay, n number of thoughts will flow into your mind. So that tells who you are, what type of a person you are, what thoughts that you are getting, how many thoughts are helpful, how many thoughts are unhelpful. Okay, when you start realizing your unhelpful thoughts, at the same time you will gain the ability to ignore them. So that tells who you are. This is very important. Next, so who you are, this is called as a mindful meditation. That's what I say. You can compare yourself to an iceberg. When you put an ice piece into the ball of a water, the 10% of the iceberg is visible, the 90% is not visible. The 10% what is visible, everyone knows it. The next 10% is floating. Sometimes it comes up, sometimes it goes down. The rest of the 80% which is there inside, this is called as unconscious content. Unconscious content. This unconscious content, it will have an impact on our health. It will have an impact on our happiness. It will have an impact on our well-being. It will have an impact on our behavior also. So therefore, when you do meditation, it will help you to realize and understand what this 80% which is influencing your behavior. Next, smile always. This is very beautiful story. Smile always. Why smile always? Sometimes we are not happy with the positions that we have been. Okay. I tell you one story. You might see a quarry worker. Bande odiyonu anta kariತೀವಿ ನಾವು ಹಳ್ಳಿಗಳಲ್ಲಿ. ಈ ಬಂಡೆ ಹೊಡಿಯೋನು ಅವನು ಜೀವನ ಎಲ್ಲ ಬರೀ ಸುತ್ತಿಗೆ ಜೊತೆನೆ ಜೀವನ ಸಾಗಿಸಿರ್ತಾನ. ಅವನು ಬೆಳಗ್ಗೆ ಎದ್ದೇಳೋದು, ಸುತ್ತಿಗೆ ತಗೊಳ್ಳೋದು, ಹೋಗೋದು, ಬಂಡೆ ಹೊಡಿಯೋದು, ಬರೋದು. ಅವನಿಗೆ ಒಂದು 60 ವರ್ಷ ವಯಸ್ಸಾಗುತ್ತಂತೆ. 60 ವರ್ಷ ವಯಸ್ಸಾದಾಗ ಆ ಬಂಡೆ ಹೊಡಿಯೋನ್ಗೆ ಒಂದಿನ ಸುಸ್ತಾಗುತ್ತಂತೆ. ಇಷ್ಟು ದಿನ ಸುಸ್ತಾಗಿಲ್ಲ, ಇವತ್ತು ತುಂಬಾ ಸುಸ್ತಾಗ್ತಾ ಇದೆಯಲ್ಲ ಅಂತೇಳಿ ಕೆಳಗೆ ಕೂರ್ತಾನಂತೆ. ಕೆಳಗ್ ಕುತ್ಕೊಂಡು ಅನ್ಕೊಳ್ತಾನಂತ ಏನಂತ ಅಂದ್ರೆ, ನಂದೆಂತ ಜೀವನ, ನನ್ನ ಜೀವನದಲ್ಲಿ ನಾನು ಏನೂ ಸಾಧನೆ ಮಾಡ್ಲಿಲ್ವಲ್ಲ, ನಾನು ರಾಜ ಆಗಿದ್ರೆ ಎಷ್ಟು ಚೆನ್ನಾಗಿರ್ತಾ ಇತ್ತು, ರಾಜ ದೇಶನೆಲ್ಲ ಆಳ್ತಾನೆ, ಅವನ್ ಮಾತಿಗೆ ಎಲ್ಲರೂ ಬೆಲೆ ಕೊಡ್ತಾರೆ, ನಾನ್ ರಾಜ ಆಗಿದ್ರೆ ಎಷ್ಟು ಚೆನ್ನಾಗಿರ್ತಾ ಇತ್ತು ಅಂತೇಳಿ ಅನ್ಕೊಂತಾನಂತೆ. ದೇವ್ರ ದಯದಿಂದ ರಾಜ ಆಗ್ಬಿಡ್ತಾನಂತೆ, ಇಮ್ಮಿಡಿಯೇಟ್ ಆಗಿ ರಾಜ ಆಗ್ಬಿಡ್ತಾನಂತೆ. ಆ ದೇಶಕ್ಕೆ ಅವನೇ ರಾಜ. ರಾಜ ಆದಾಗ ಖುಷಿ ಆಗ್ಬಿಡ್ತಾನೆ, ನಾನು ರಾಜ ಆಗಿದ್ದೀನಿ ಇವಾಗ ಅಂತೇಳಿ. ರಾಜ ಆದಾಗ ಆ ಸಾರೋಟ್ ಮೇಲೆ ಬರ್ತಾ ಇರ್ತಾನಂತೆ, ವಿಪರೀತ ಸೆಕೆ. ಇ ವಾಸ್ ಕಮಿಂಗ್ ಆನ್ ದ ಚಾರಿಯಟ್, ವಿಪರೀತ, ಇ ವಾಸ್ ಸ್ವೆಟಿಂಗ್ ಲೈಕ್ ಎನಿಥಿಂಗ್, ತುಂಬಾ ಸೆಕೆ. Then all these, Raja's costumes and everything, he was irritating a lot. It was irritating him a lot. Then he decides that ಇದು ಯಾವ ತರ ಜೀವನ ಇದು ಬೇಡ ಅಂತೇಳಿ ಈ ಜಸ್ಟ್ ಮೇಲ್ ನೋಡ್ತಾನ, ಜಸ್ಟ್ ಸೀಸ್ ಅಪ್. ಮೇಲ್ ನೋಡಿದಾಗ ಇಷ್ಟೊಂದು ಸೆಕೆಗೆ ಕಾರಣ ಯಾರು ಅಂದ್ರೆ ಸೂರ್ಯ ತುಂಬಾ ಪವರ್ಫುಲ್ ಅಂತ ಅನ್ಕೊಳ್ತಾನೆ. ಸೂರ್ಯ ತುಂಬಾ ಪವರ್ಫುಲ್, ನಾನು ಸೂರ್ಯ ಆಗ್ಬಿಡೋಣ ಅಂತ ಅನ್ಕೊಂತಾನೆ. ಯಾವಾಗ ಅವನು ಸೂರ್ಯ ಆಗ್ತಾನೆ, ಇಮ್ಮಿಡಿಯೇಟ್ ಆಗಿ ಸೂರ್ಯ ಆಗ್ಬಿಡ್ತಾನೆ ಅಂತ ಅನ್ಕೊಂತಾನೆ, ಸೂರ್ಯ ಆಗ್ಬಿಡ್ತಾನೆ. ಆವಾಗ ಮೇಲ್ ನೋಡಿ ತುಂಬಾ ಖುಷಿ ಪಡ್ತಾ ಇರ್ತಾನೆ, ಇಡೀ ಜಗತ್ತಿಗೆ ನಾನೇ ರಾಜ, ನಾನೇ ದೊಡ್ಡವನು, ನನ್ ಬಿಟ್ರೆ ಯಾರೂ ಇಲ್ಲ ಅಂತಾನೆ. ಫುಲ್ಲು ಸ್ವಲ್ಪ ದಿನ ಆಗುತ್ತೆ, ಸೂರ್ಯ ಒಂದು ಆ ಪೊಸಿಷನ್ ಎಂಜಾಯ್ ಮಾಡ್ತಾ ಇರ್ತಾನೆ. ಒಂದು ದೊಡ್ಡ ಮೋಡ ಸೂರ್ಯನಿಗೆ ಅಡ್ಡ ಬಂದ್ಬಿಡುತ್ತಂತೆ. ಅಡ್ಡ ಬಂದಾಗ ಅವನಿಗೆ ಭೂಮಿ ಮೇಲೆ ಏನಾಗ್ತಿದೆ ಕಾಣಿಸೋದೇ ಇಲ್ವಂತೆ, ಸೂರ್ಯನ ಕಿರಣಗಳು ಕೂಡ ಭೂಮಿಗೆ ತಾಕೋದಿಲ್ಲ. ಆವಾಗ ಅನ್ಕೊಂತಾನಂತೆ, ಇದೇದು, ನಾನು ಸೂರ್ಯನೇ ತುಂಬಾ ಪವರ್ಫುಲ್ ಅಂದ್ರೆ ಮೋಡ ಸೂರ್ಯನಿನ ಪವರ್ಫುಲ್ ಅಲ್ಲ ಅಂತ ಹೇಳಿ ಮೋಡ ಆಗ್ಬೇಕು ಅನ್ಕೊಂಡು ಮೋಡ ಆಗ್ತಾನಂತೆ. ಮೋಡ ಆದಾಗ ಮತ್ತೆ ಅದೇ ಖುಷಿ, ನಾನೀಗ ಪವರ್ಫುಲ್, ಜೋರಾಗಿ ಗಾಳಿ ಬೀಸುತ್ತಂತೆ. ಆ ಗಾಳಿ ಮೋಡನ ತಗೊಂಡಾಗ ಯಾವ್ದೋ ಮೂಲೆ ಬಿಡುತ್ತೆ. ಅವಾಗ ಅನ್ಕೊಂತಾನಂತೆ, ಗಾಳಿ ಮೋಡನ್ಗಿನ ಪವರ್ಫುಲ್, ನಾನು ಗಾಳಿ ಆಗ್ಬೇಕು ಅಂತ ಹೇಳಿ ಗಾಳಿ ಆಗ್ತಾನೆ. ಗಾಳಿ ಆಗುತ್ತೆ, ಜೋರಾಗಿ ಬೀಸ್ತಾ ಇರ್ತಾನಂತೆ. ಭೂಮಿ ಮೇಲಿರೋ ಮರ ಗಿಡ ಎಲ್ಲ ಫುಲ್ಲು ಅಲ್ಲಾಡಿ ಹೋಗ್ತಾ ಇರುತ್ತೆ, ಎಲ್ಲ ಫುಲ್ಲು ಆರು ಹೋಗ್ತಾ ಇರುತ್ತೆ. ಒಂದು ಬಂಡೆ ಕಲ್ ಮಾತ್ರ ಅಲ್ಲಾಡದಿಂದ ನಿಂತ್ಕೊಂಡಿರುತ್ತೆ. ಆ ಬಂಡೆ ಕಲ್ ಅಲ್ಲಾಡೋದೇ ಇಲ್ವಂತೆ. ಅವನಿಗೆ ಅನ್ಸುತ್ತಂತೆ, ಬಂಡೆ ಎಲ್ಲದಕ್ಕಿಂತ ಸ್ಟ್ರಾಂಗು, ನಾನು ಬಂಡೆ ಕಲ್ ಆಗ್ಬಿಡೋಣ ಅಂತ ಹೇಳಿ ಗಾಳಿಯಿಂದ ಇಮಿಡಿಯೇಟ್ ಬಂಡೆ ಕಲ್ ಆಗ್ತಾನಂತೆ. ದೊಡ್ಡ ಬಂಡೆ ಕಲ್ ಆಗ್ತಾನಂತೆ. ಇವಾಗ ನಾನು ಫುಲ್ಲು ಪವರ್ಫುಲ್ ಅಂತ ಅಷ್ಟೇ ಇನ್ನೇನ್ ಹಂಗ ಅನ್ಕೊಂತ ಇರ್ತಾನೆ, ಒಂದು ಸುತ್ಕೆ ಹೊಡ್ತಾ ಜೋರಾಗಿ ಬೀಳುತ್ತಂತೆ ಬಂಡೆಗೆ. ಬಂಡೆಗೆ ಬಿದ್ದ ತಕ್ಷಣ ಬಂಡೆ ಪುಡಿ ಪುಡಿ ಆಗುತ್ತಂತೆ. ನಾನೇ ಫುಲ್ಲು ಗಟ್ಟಿ ಅಂದ್ರೆ ನನ್ನನ್ನು ಯಾರು ಹೊಡೆದಿದ್ದು ಅಂತ ಹಿಂದೆ ತಿರುಗಿ ನೋಡ್ತಾನಂತೆ. ಅದೇ ಬಂಡೆ ಹೊಡೆಯೋನು ಆ ಬಂಡೆ ಹೊಡೆದಿರ್ತಾನೆ, ಆ ಬಂಡೆ ಹೊಡೆದಿರ್ತಾನೆ. ಅಲ್ಲಿಗ ಪವರ್ಫುಲ್ ಯಾರು? ಹೂ ಇಸ್ ದ ಪವರ್ಫುಲ್? ಬಂಡೆ ಹೊಡೆಯೋನು. ಸೊ ಟು ರಿಯಲೈಸ್ ದಟ್ ಬಂಡೆ ಹೊಡೆಯೋನು ಅಷ್ಟು ಶಕ್ತಿ ಇದೆ ಅಂತಂದೇಳಿ, ಟು ರಿಯಲೈಸ್ ಹಿಮ್ಸೆಲ್ಫ್, he has become a king, he has become a sun, he has become a cloud, he has become a wind, he has become a rock, and finally he has become that quarry worker only. Okay, like that nammallu kuda irutte. Yes, we have enough amount of potentialities and abilities and strengths. Okay, but you have to realize it. You have to realize it. Simply just we compare ourselves with other person. ಬೇರೆಯವ್ರಿಗೆ ಹೋಲಿಕೆ ಮಾಡಿ ನಮ್ಮನ್ನು ನಾವು ಕಡಿಮೆ ಮಾಡ್ಕೊಳ್ತಾನೆ ಇರ್ತೀವಿ. Okay, instead of that, try to understand your own self. It's a beautiful self. Then you will see a beautiful person in the mirror. ನಿಮ್ಮ ಆಲೋಚನೆಗಳು, ನಿಮ್ಮ ಶಕ್ತಿ ಸಾಮರ್ಥ್ಯದ ಬಗ್ಗೆ ನಿಮಗೆ ಜ್ಞಾನ ಇತ್ತು ಅಂತಂದಾಗ, ಯು ಆರ್ ದ ಮೋಸ್ಟ್ ಬ್ಯೂಟಿಫುಲ್ ಪರ್ಸನ್ ಇನ್ ದ ವರ್ಲ್ಡ್. ಯಾವಾಗ ನಿಮಗೆ ನೀವೇ ವಿರುದ್ಧವಾಗಿ ಇರ್ತೀರಾ, you seems to be very ugliest person in the world when you see yourself in a mirror. ಹಂಗಾಗಿ ಕನ್ನಡಿಯಲ್ಲಿ ನಿಮ್ಮನ್ನ ನೀವು ನೋಡ್ಕೊಳ್ತಾ ಅಂತ ಖುಷಿ ಆಗಿರ್ಬೇಕು, ಅದ್ ಬಿಟ್ಟು ಇದೆಂತ ಜೀವನ ಅನ್ನಂಗಿರ್ಬಾರ್ದು. So therefore, this is about well-being. This is about well-being. But in the next session, how yoga is important and how yoga contributes to well-being, ನಾನು ನೆಕ್ಸ್ಟ್ ಸೆಷನ್ ಅಲ್ಲಿ ತಗೊಳ್ತೀನಿ. ಒಂದು 5 ನಿಮಿಷ ಟೈಮ್ ಇದೆ, ಏನಾದ್ರೂ ಪ್ರಶ್ನೆ ಕೇಳ್ಬೋದು. We have another 5 minutes of time. We can keep it for the discussions. Yes, ma'am. Any question?
Sir, I think I asked my observation. Those who are practicing yoga and these people, still they have a lot of egos. What is the reason for that?
Sir,
ಮ್ಯೂಟ್ ಮಾಡ್ಕೊಳ್ಳಿ ಯಾರು.